This series of videos is for Tom and Kristen and David and others who have graciously agreed to help out in the intensive care unit during the coronavirus epidemic, or really anybody else who wants either a refresher or an introduction into how ventilators work. The first thing to understand, we'll start from the beginning. The first thing to understand is that ventilators work by pushing air into the lungs. That's different from how we normally breathe. We normally breathe, as you know, by decreasing the pressure in our chest, and then air flows in. In contrast, ventilators work by pushing air into the lungs. When ventilators do that, a fair amount of pressure gets built up in the lungs, and then what the ventilator will do is allow that pressure to be released, and when that happens, air flows out and the patient expires. If you ever get lost or confused, just come back to that basic idea that what ventilators do is push air into the lungs and then allow that air to come back out. So let's kind of diagram out how that works. We'll say this is a patient here with an ET tube in their mouth. See, that's the nose, that's the neck, you get the idea. And then this is the lungs, and we'll say this is a representative alveolus in the lungs. And then the ET tube gets connected to what we call the Y piece, and then that Y piece gets connected through two separate limbs back to the ventilator over here. And that's the Y piece, so called because it's shaped like a Y, although we will sometimes see the word Y written W-Y-E, but most people just spell it out as Y piece because, again, that's the way it looks. And then what will happen is the ventilator will have a valve on each of these limbs. Now, why two limbs? One is for inspiration, one is for expiration. If we only had one limb, then air would be going back and forth kind of through that limb into the lungs, back into the tubing, back into the lungs, back into the tubing. There really wouldn't be a lot of gas exchange taking place. Of course, we would call that dead space. But with two limbs, we have an inspiratory limb and an expiratory limb. And the basic principle here is that during inspiration, the expiratory valve will be closed and the ventilator will push that air in. As it does that, the air in the expiratory limb will, at least in theory, just sort of sit there. And again, as the ventilator pushes air in, the alveolar pressure will get up to something pretty high, maybe something up to like 20. And then when we switch over to expiration, the expiratory valve opens, the inspiratory valve closes. And then most of the time, we set a PEEP. PEEP is going to function as sort of like a back pressure. You could think of it as a back pressure here. If you set your PEEP at 5, then the ventilator will try to maintain a pressure of 5 here in the expiratory limb. But remember, our alveolar pressure is 20. So now we've got a pressure gradient of 20 here to 5 here. So air will come out until the lungs, and as air comes out, the lungs will deflate, and eventually they'll get to the point where the alveolar pressure is 5 and no more flow will come back out. And then next breath will come and the ventilator will push air in again. Now, the details of how the ventilator pushes air in will depend on what mode you have them in, as well as a number of other decisions that you make. Perhaps the first and foremost, most basic decision you have to make is, do you want to tell the ventilator to put in a certain volume of air, or do you want to tell the ventilator to put in a certain pressure into the inspiratory limb? If you tell the ventilator to put in a certain volume, then you won't have precise control over how much pressure it uses to do that. On the other hand, if you tell the ventilator to put a certain pressure into the inspiratory limb, then you won't have control over what volume the patient gets. For the vast majority of patients, either system can work just fine. But whichever one you choose, there are trade-offs, and the better end of those trade-offs will depend on what's happening for the patient at any given point in time. In our next video, we'll talk about one of the most commonly used modes of mechanical ventilation over the past several years. That is assist control, also goes by the name volume control. This is one where we set the ventilator to give a certain amount of volume. It's relatively foolproof and it's enjoyed widespread use over the past several decades. So we'll talk about that in our next video.